It's time for Health Futures with Cypress Home Care Solutions, Bob Roth. This is Arizona's only show dedicated to providing you with expert advice on how to live a longer, healthier, and happier life. To learn more, call 602-264-8009. That's 602-264-8009. Now, here's your host, Bob Roth.
Good afternoon. You're listening to Health Futures, taking stock in you. I'm your host, Bob Roth, and it must be Friday, and indeed it is. We're coming at you live from the Scottsdale Air Park Money Radio Studios, 1510 AM, 105.3 FM, and the World Wide Web, moneyradio1510.com. If this is the first time you're tuning in, this is a show about how our older adult population can live a healthier, happier life. How do they do that? They do that by listening right here. Not to me, but to these extraordinary guests that we bring onto the show. So we're coming at you on the last Friday of 22. Unbelievable how time just flies. December 30th, 2022. And I'm really proud to have this guest here in the studio with me, and she does amazing work. She is the Vice President of Communications for Arizona Hospital and Healthcare Association. Welcome to the show, Holly Ward.
Hey, thanks for having me.
It's good to have you here on the show. And, you know, I would love for you to really explain to our listeners a little bit about Arizona Hospital and Healthcare Association and the work that you do.
Sure. Well, we are an advocacy and policy organization, which really means we have member hospitals. Our board of directors are CEOs from hospitals across Arizona in big cities, little cities, caring for you, our patients. And we are focused on really policy issues down at the state capitol with the governor's office, making sure that the legislation that goes through is really good for hospitals and the patients we serve.
And you know what, we rely so much on hospitals, and you and I got a chance to talk just as the show got started. You're native.
Yes.
You're here from Arizona.
Born and raised, yes,
born and
right
raised.
Here in Phoenix.
And
yes.
it is crazy how this city and Maricopa County and the state has grown.
Gosh, I always say if I had only invested my babysitting money in land north of Bell Road, I would have been just set for life.
Yeah, you wouldn't be working. You'd
Yeah.
probably buy an island somewhere and
Right.
be drinking whatever with an umbrella in it.
That's right.
No, but seriously, you see the growth, and I forget the data point, but I think there's about 6.6 million people live in the state, and about 4.8 live right here in Maricopa County, and the hospitals are growing. I've lived here almost 30 years, and I'll just talk about one that's right here in our backyard. It used to be Scottsdale Memorial, and then it was Scottsdale Healthcare, now it's Honor Health.
Yes.
I mean, they're opening up hospitals everywhere.
Yes. We need to be there to meet the needs of our communities.
Because the community continues to sprawl and
Yes.
grow.
Yes, and we really want to make sure that as an Arizona hospital organization overall, that we do have that coverage. There are such finite needs and specialties now as medicine advances, but also the needs of our patients. We need to be there for them.
And it's funny, you talk about specialties, and I think of centers of excellence, and many of the hospital brands, if you would, here have those. When I first moved here almost 30 years ago, if you were undergoing treatment for cancer, there were very few places to go.
Right.
Matter of fact, one of the board members for the company I was working with used to travel 2 to 3 times a week down to Tucson
Yes.
to University Hospital
Yes.
to get treatment because they couldn't get it here.
Right.
It is amazing. It really is. And, in terms of your association, I mean, obviously you advocate for all the hospitals, and
Right.
you are in front of the legislature.
Right.
And I, too, have spent some time down there. And certainly you're constantly educating, especially when you're really looking at, these offices turn over like every 2 years.
That is true.
So
it is an educational process.
Yeah, it's not
yes.
like the U.S. Senate, where you got someone there for 6 years in the Senate and 2 years in the House of Representatives.
Right.
But, I mean, many of these people that are in these really pivotal roles, they turn over every 2 years. And once they get in, they're already campaigning for the next cycle.
Right. But our hospitals do such a great job. It's so impactful in the rural communities, especially, the smaller towns, that they're inviting those legislators in to see, here's what we do, here's what's happening, we are your neighbors, and kind of peel back that curtain to avoid any mystery.
Absolutely. It's funny because I am in the healthcare space, and I run a home care company on behalf of my family members. We do in-home care supportive services. But a long time ago, I was doing durable medical equipment and respiratory. I had offices in Lake Havasu. I had offices in Yuma. At Yuma Regional, I remember like yesterday.
Yes.
I mean, that hospital probably looks very different than it did 25 years ago.
Yeah, they're providing fantastic care. They just had quality excellence awards among their employees, and it was a competition, and such a great, invigorating thing to see that we actually went and participated in the judging. But so all the employees are competitive with each other to prove, I did the best innovation. No, I did the best innovation.
Gotta love that.
It's a win-win.
And especially when you get the employees engaged.
Absolutely. Yeah.
And then I also think of the one hospital up in Prescott Valley.
YRMC. Yes.
YRMC. I mean, they do a fantastic job as well.
Yeah.
And as we're talking about hospitals, and we'll do a deeper dive into the trade association in a second. But you're native here, and these hospitals, John C. Lincoln, Scottsdale Memorial, and I'm just talking about the ones, Good Samaritan.
Right.
They were all community based, and they really did a really good job of outreach to the community. If you just put your Arizona hat on, your community hat, obviously the hospitals have gotten bigger. There's been some acquisitions. Do you feel like they're still community based? Do you feel like they're still reaching out to the community?
Really, at the end of the day, the people inside those hospitals, their goal is to get you well. So yes, you can focus on big acquisitions, but the care that is provided once you walk inside that door is really special and really focused on that patient that is in front of them right then.
That's important. It really is, especially as a member of the community. And certainly, like my family was 37 years a supporter of Honor Health or Scottsdale Memorial. They're benefactors. You want to support the hospital.
That's great.
And you love seeing that. So the elephant in the room
Yes.
is obviously COVID. And,
Right.
I don't want to go backwards and talk about what we dealt with for the last 2.5, almost 3 years.
I don't
but
think any of us do.
we
Yeah.
don't. We don't. But this triple threat that we're dealing with right
Yes.
now, and that is what everybody's hearing in the news. They're talking
Right.
about the flu being the worst it's been in over 10 years.
Yep.
Talking about COVID cases, and I for one avoided COVID up till about a little more than a month ago, and I too got
Almost did it.
I almost did it, but
Yes.
you know what? Thank goodness for vaccinations. Thank
Yes.
goodness for treatment. It was a cold. It literally was a cold.
That's
I mean,
great.
4 days later, 5 days later, I tested negative.
Good.
But then also RSV.
Mm-hmm.
And, I want to tee it up because we'll talk more about this in the second segment. But, talk to me about how your trade association has been able to coalesce and bring the hospitals together to really fight this and really prepare for this onslaught of, patients and need. I mean, we hear in the news that, the beds are full
Yes.
and, the emergency rooms are full. This is a tough time right now. And it always is this time of year anyway. We always get respiratory
Correct.
viruses this
Yes.
time of year.
Yes, but this year it was special because, as everyone listening has probably read the headlines, that we're having the highest amount of flu cases at this time compared to other years. And that match that with COVID and RSV, which is really troublesome for the younger and elderly populations. It hits them harder, a respiratory virus. So we did convene the chief medical officers and then local public health from all 15 counties in Arizona, and that's significant.
That is.
Yeah, it was a big deal, meaning that the significance of how high the case counts are, everybody was trying to flag and say, this is a challenge.
No doubt. And certainly, because Arizona's big geographically,
Yes.
everyone's not able to get in the same room. I'm assuming you're using technology.
Absolutely. Those virtual meetings have become just second nature.
No, and that's nice. And I mean, let's face it. I mean, COVID really helped us to, especially healthcare.
Right.
I mean, you talk about telemedicine. We're up against a break. I want to finish this, though, when we come back. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth. I've got Holly Ward here in the studio with me. She is with Arizona Hospital and Healthcare Association. Stick around. We'll be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth, and it is Friday, and it is in our second segment, and this is the last Friday of 22. We got a special show here today, and if you missed the first segment, go up to our website, to cypresshomecare.com, click on the media button. The button just below that is radio show. You'll catch this one and many more. So I'm really privileged to have Holly Ward here in the studio with me. She's the Vice President of Communications for Arizona Hospital and Health Care Association. And in our end of our first segment, we were really talking about how the medical officers, chief medical officers of all these hospitals are coming together, Holly, and you guys are facilitating that as a trade association to really talk about this triple threat that we're dealing with right now. And it's not just this triple threat. I'm sure you guys come together on a lot of occasions, but talk to us a little bit about you guys facilitate this. I mean, you have all these brilliant minds together. How do you get them all walking down the same path together?
Well, yeah, surprisingly, it was so easy because the focus is clear. We have rising case counts in respiratory virus, and this was really unique. This does not happen a lot for this magnitude of a group to come together, all focused on one call for action, if you will. So it's really exciting to see. And really their goal is twofold. One is to really make sure that folks know, as emergency rooms are being used more, that the information is out there to choose the right level of care, maybe not just head to the emergency room if it's not a true emergency. They're telehealth. You mentioned, Bob, in the first segment.
Right.
Telehealth options, see your primary care provider. Urgent care is another option so that really you don't sit there waiting for long times in the emergency room. And then the other thing is really just to take care so that you're preventing the spread of virus. And, these tips are not new, but they are tried and true. So they are things like, making sure you stay home when sick. Get vaccinated. We have vaccines for flu and COVID. Washing your hands, simple steps.
Right.
And, it's the end of the year. We've just made it through half of this holiday burst. We still have New Year's ahead of us, but, take care of yourself and get your rest so that, we've been running ragged, trying to get those gifts together and now going to, kick off the new year. Make sure you're getting enough sleep and taking care of yourself so that you're not getting sick with downtime.
Right. And certainly with New Year's coming up on us, we did see an uptick after Thanksgiving and Christmas, and we just need to be mindful. All those tips you gave are great, and look, if you're feeling unwell and you got to go out, we've learned how to use a mask.
Yes.
Wear a mask.
Yes.
I mean, you're protecting the person that could be vulnerable. It could be an older adult. It could be a young child. I mean, this respiratory virus that you're talking about, those are the people we worry about. Young children, older adults, and anyone that's immune compromised.
Right.
We have to protect them. And if you are one of those people that are listening to the show right now and you have someone that's unwell and fits into those categories, you should be seeking medical help.
Yeah, and one of our docs from Valleywise Hospital, he recently said that his emergency department is seeing 30 to 40% more patients than they typically do during this time.
Wow.
So, you've got to think about that, what that means practically at the hospital. And, let's think about our healthcare workforce. They're humans just like we are. The burnout is real.
It is.
They are there to help you. But they need some help right now, too, for folks to really try to do what they can to stop the spread so that we're not overtaxing those emergency rooms.
I'm not here to promote one hospital versus another. And, it's so nice that you're able to get them all in the room together because they kind of compete for care,
yeah, it's
right?
Business.
And,
Yes.
and I really, as we've grown, it's been really interesting to watch, Holly, to see that these Urgy centers for competing brands are showing up right across the street from the competing hospital. And I'm like, oh man, that reminds me of the grocery store. You open up right across from one another because you're trying to capture some of that base, if you would. But you mentioned Valleywise, and for us that have lived here for a while, I mean, we all remember Maricopa County Hospital. I mean,
Yes.
they've gone through a transformation like nobody's business.
It is quite amazing to see, and I am biased because they have a special place in my heart at Valleywise Health, but they provide such exceptional care with their level 1 trauma centers, their burn center, which is phenomenal.
It is one of there are two west of the Mississippi, and that is one of the premier burn centers.
Yes.
If you know of someone that had a burn or come in the future, you want to go to Valleywise.
Yes, and it is a hospital with such heart. And it's our safety net hospital in Arizona, and just such a great special place.
And I like how you put that because it is our safety net hospital. And I was thinking about getting into this in a later segment, but let's chat about it now. A lot of these hospitals, and having served on the board for one of them, they give so much in charity care, and they write off so much where they don't get paid. And Valleywise is probably the biggest, because they too take in so many people that don't have insurance. How do these guys do this?
I don't know that I'm expert enough to speak to the exact financials, but I think just above all else, it's we're there to provide care, whether you're going to pay or not.
Right.
So it goes back to why a lot of our providers got into this business. They wanted to help people and help them get well.
Well, and quite frankly, I mean, you're able to do that too from the support from our government, our state government. And I know that you and your team and many of these members of your association are down at the legislature. We talked about it early before the show, talking about how these people turn over every 2 years, but you got to get in front of them. You have to help them understand the value that you bring to the community that we serve.
Because every year there are bills that are introduced, and that what might start as what's a good idea might prove to be a little bit complicated. Hospitals are required, they have licensing requirements from the state, from the feds. So a good idea and something in a bill might be a little problematic for us to make sure that we're in compliance.
Unintended consequences.
Exactly.
Conceptually it may be good, but the consequences could be many. So I would imagine through your office, you guys know them very well down in the legislature.
Yes. We have a fantastic director of government relations. Shout out to Megan McCabe, who really works with our member hospitals who are also doing that good work relating to their legislators.
No, that is awesome. So really, as we wind down this second segment, and we're really talking about the respiratory viruses and all this stuff that is going on, what advice can you give our listeners? I know a lot of these hospitals have online ways to check the waiting room in EDs. What advice can you give our listeners as they prepare for maybe a loved one that might need to get some care?
That's a really good question, and I think it's great. What a good time if you're well right now, just to refresh yourself with what's nearby. Where might you go, and what levels of care are available, whether we're talking telehealth, urgent care, your primary care physician. It's probably a good idea, put on your New Year's resolution list just to do a check-in of, what hospital might I go to and what other options are nearby Because when you're in an emergency, it's hard to think
It is.
quickly. So be a good idea just to survey your options.
Well, I know I'm going to talk about in the second half, I want to talk about advanced directives and planning. But, really, one of the things that we really need to do as people, and especially as, so many make resolutions, but I mean, taking care of your health is so important.
It really is.
And, we've been through a tough 3 years. And it's time now that we take inventory of our health and really live the best life we can. And, I'm not a big fan of resolutions, but I mean, it's time to really take inventory and say, okay, how can I live the best life I can? And to avoid illnesses, and the best way to avoid illnesses is to be in very good health.
Right.
Because as we talked about it before, I mean, those that are immune compromised and are not in good health, they're the ones that have bad outcomes. We saw that with COVID.
Right.
You're listening to Health Futures, Taking Stock on You. I'm your host, Bob Roth. It's halftime here at Health Futures. I've got Holly Ward here. She's from the Arizona Hospital and Healthcare Association. Stick around. We'll be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth, and we are in our second half here. If you are just tuning in, I've got Holly Ward here in the studio with me. She's with the Arizona Hospital and Healthcare Association. She's the Vice President of Communications. And we have been talking about a number of different things. The biggest one we're talking about is the triple threat that's happening right now with the flu, COVID, and RSV, and really the pressure that is being put on the hospitals and their emergency rooms. And if you missed it, you need to go back and check it out, because Holly gave some great tips in terms of how to deal with this and how to pick the appropriate hospital and emergency room for the needs that you may be dealing with. You can catch that up on our website at cypresshomecare.com. Media buttons on the top right below is the radio show. So Holly, I want to spend some time here in the second half really to talk about something that is really near and dear to me and anyone that is in the healthcare vertical, is really talking about advanced directives.
I am so excited we're going to talk about this.
Thank you.
Yes.
I mean, you know what? No one wants to talk about this stuff. Nobody wants to talk about dying.
Right.
But we have to have these very thoughtful conversations.
Yes.
Because when you, the person you love, becomes incapacitated, you don't know what their wishes are.
That's exactly it.
And it's a gift that you can give to your loved ones by telling them what those wishes are.
Right. And this came up during the pandemic. This really pointed to why this is important to plan for your medical decisions. We saw this when family members were left to figure out or give their best guess as to what their loved one wanted for their medical wishes. It's really tough to experience as the healthcare provider when it's really, it may be a difficult conversation for you to have or to think about, but it is so important, and it's such a gift to you and to your loved ones.
You know, they say there are two things that are guaranteed in life: taxes and death.
Yes.
And you know, I unfortunately I experienced last month losing my dad, and
I'm so
and
sorry.
Thank you. But my dad, you know, he was very organized. I mean, he spelled it out really clearly to us what his wishes were. So I had all those, and he kept them up to date, and that's the other thing that's really important
yes.
too, because it's one thing to put them down and memorialize them, but life changes. You know, people get divorced, children, you know, come into the world, people die, you know, so anyone that you're naming, you need to refresh that, and you need to keep that top of mind.
And that's an important testimonial. I mean, and think about from your perspective where you're dealing with grief.
Yeah.
And having to think about what to do. What a gift that your dad gave you to plan it out.
I lost my mom 20 years ago, and I lost my stepmother because he got remarried about 20 months ago.
Wow.
And, you know, Dad did an amazing job because, you know, after she passed in March of 21, in May of 21, he sat back down with his estate planning attorney and redid all his documents because she was no longer in his life, and just wanted to make sure that, you know, his wishes were really clearly spelled out. And I got to tell you, I mean, it's been very, very helpful. Now, we talk about hospitals, and people go into the hospital for a number of different reasons, some for planned surgeries, some for unexpected surgeries, some for unexpected ED visits.
Right.
It's really important that you, especially if you have advanced directives, and specifically, you know, living wills and those types of things, whoever your appointed attorney that you might have power of attorney that you might have selected, all that stuff should be in order. And
Yes.
and the great thing is, I mean, look, unfortunately, I've had to go into the hospital a couple of times. I made sure the first time I went there, I brought them with me.
Good for you.
And what did they do? They took them. They gave them back to me because they scanned them all in.
Yes.
And they
Now
were
they're
in
on
the
record.
system,
Yes.
their own record.
Yeah. And the great thing is we have at the Arizona Hospital and Healthcare Association, we've taken great steps to make these forms accessible. So this is a big, new, exciting initiative for us. We have documents that, you know, there are a lot of documents. Which one do I pick? We have now updated our forms on our website to help you find exactly what you need, because there are several that you could fill out. They're all voluntary. None of them are needed. But I think the one form that's the most important is what we call the Arizona short form, but it's really the living will. And it's your one-stop shop to help you see all of the forms that are available to you. So that's on our website, azhha.org. But you can fill out that medical living will. And it really explains, what do you want for medical care? Who's in charge of making those decisions if you cannot? You can get it notarized, or you can have a witness sign it with you, and then really share it with your primary care provider. Like you just said, Bob, you took it with you. And so you shared it, and share it with your friends and loved ones. You know, doing this work doesn't do any good if you keep it in a file drawer and it's not shared.
Or your attorney has it. And
Yes.
important to know, you don't need an attorney.
You
and
don't.
and
No.
that's the beautiful thing,
Right.
is you can go to your website, you can go to the Secretary of State website, you can go to the Arizona Attorney General's website. I mean, there's so many resources that are out there.
Yes.
It's just, you know, my appeal to our listeners is nobody wants to talk about dying,
Yes.
but it is all, it's going to happen to all of us.
Right.
You know, I think Billy Crystal, you know, he had a line in his book that he wrote when he turned 65 about people in the cemetery. He said every single person in that cemetery thought they were going to get past the bouncer and be able to live out their lives, but no one ever does. The fact is that we all are going to get there.
Yes.
It's really, you know, that gift that we can give our loved ones by telling them what our wishes are. You know, Dr. Kevin Hazelhorst, he is a physician over at Arrowhead. He works in the ED department. He's done TED Talks. He's also he wrote a book called Wishes to Die For. And he's been right here in the studio with you, me, right
Yes.
where you're sitting. And he's talked about this very subject. And he talks to his patients that come in. He goes, look, I can stick a lot of tubes in you.
Right.
And we can keep you alive if that's what you choose to be. Or we can make you comfortable. You know, which one do you want?
And it's really your choice. Yeah.
Exactly.
So we'd love to do what you wish to have done.
And so important
Yes.
for you to have these conversations. And again, I want to make it very clear, plural conversations, because this isn't a one-time conversation.
Right.
And, you know, right now, you know, as we do resolutions, and I know I share it, I'm not big on resolutions, but this is a resolution that you should make if you haven't done this, is to sit down with the people you love, whether it be a spouse, a partner, a parent or grandparent, and really talk about these conversations. And by the way, it's not just for old people.
It is not. Thank
It's
you
not.
for saying
and,
that.
and you know what? If
Yes.
you're 18 years old or older, you should have these directives in place.
Right.
I've had estate planning attorneys here in my studio and talking about this. And, you know, if you have a child that just graduated high school and is going to go away to college and is 18 years or older, you should have this, because God forbid they were to get in a car accident. You don't really have rights. If you're 2,000 miles away or
Right.
200 miles away,
Right.
they are an adult, and you need to know what those wishes are.
Right.
Just because you're their parent, you can't make those informed decisions without knowing what having those powers, having the medical power of attorney, having a living will, and all those things that we talk about is so important.
It is.
And
Thank you for that.
Oh, you're welcome. And the last one I want to talk about is, Arizona is very unique in the sense that we have what they call a mental power of attorney. And that is very different from many other states because look, we have a high incidence of Alzheimer's. Arizona is one of the highest. It's, I think, the 4th leading cause of death, where Alzheimer's is, I think, the 5th nationally. And it's no surprise. I mean, we have an older population here. And, there are people that become mentally incapacitated, and we need to have those powers put in place. So I don't know if that's up on your website. I know it's up on others, but, if you are seeking advice from a professional, you should be having those conversations too. Having a mental power of attorney is really important.
Right. And I would just say for anybody who might be listening to this and kind of, squishing a little bit in their seat, I think getting started is probably the hardest step. Just, committing, if you're a little hesitant, just take that step. Take a look at the form, and I pretty much guarantee that once you start filling it out, you just have this sense of relief because it's now no longer unspoken. It's you've got it planned out, and it's with your decisions that you want.
Any suggestions on how to get the conversation started? Because it's not a sexy one.
Yeah, right, right. So we do offer some of that on our website, but it's really just finding what works for you, whether it's sitting folks down and say, hey, I have something I want to talk about. It might be uncomfortable, but this is really important to me. Just opening that door. And if find that you're not able to have that conversation, at the very least, just filling out these forms so that your healthcare provider can help you with your family.
And talk about how it's a gift that you can leave us, because it really is a gift. Well, you're listening to Health Futures. You hear the music. Taking stock in you. We're down 3 segments. We got one more to go. I've got Holly Ward here in the studio. She is with the Arizona Hospital and Healthcare Association. Stick around. We're going to talk about a look ahead for hospital issues in 23. Stick around. We'll be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth, and we are in our 4th segment. If you're just tuning in, I've got Holly Ward here in the studio. She's the Vice President of Communications for the Arizona Hospital and Healthcare Association. If you missed the first 3 segments, go up to our website at cypresshomecare.com. Click on the media button. Button just below it is radio show. You'll catch the first 3 segments and many more. So it's hard to believe that it is the last Friday of 22. 23 actually starts my 10th year here on the air doing Health Futures. It's hard to believe that I've been here doing this show for 10 years, but they keep having me back, and it's because of guests like you, Holly, that are bringing meaningful content to our listeners. As we wind down this year, I really want to take a look into 23 and, what are some of the, challenges and the issues that you're looking at in 23. Hopefully we got, some of this bad stuff behind us, and I'm talking about COVID and some of the other stuff, but
Right.
What are some of the things you're looking forward to in 23?
We have a few things on the horizon, and unfortunately, as we talk about COVID, we keep wanting to say, okay, we've been there, done that. Let's move forward. But the ripple effect is a real factor. So things like strengthening and supporting our healthcare workforce, everything you can imagine. These healthcare individuals saw incredible stress and strain just personally. And when COVID first started, we were flooded with very sick people and people who were dying, and that's hard to take as a healthcare worker. And and so the burnout's real. We had the Great Resignation across every industry, but we started losing healthcare workers. They didn't want to put up with that, and so traveling nurses, I think, were a big factor where they were paid a lot of money to travel to different places when there was a surge, meaning an increase in hospital visits. Hospitals could hire traveling nurses, but then that created such an unrealistic expectation for salaries in general. So hospitals are having to hire when I can go be a traveling nurse and make exponentially more versus being on staff at your hospital.
And I'm going to tell you, my daughter, who's a nurse,
Yes.
went to school with a number of people that worked as traveling nurses,
Yes.
and the amount of money they made was obscene. Now, don't get me wrong. They were on the front lines.
Right.
And all the things that you talked about.
Right.
But, they were young. They maybe, could handle a little bit better maybe. I don't know. But, you got to travel the world, and you got to, travel the country at least,
Sure.
and got to make a lot of money. I mean,
Sure.
obscene amounts of money. I mean,
Sure.
crazy. And that comes at a cost.
Right.
Comes at a
Right.
cost from a staffing standpoint for a hospital.
Yes.
It comes at a cost financially for that hospital.
Yeah. So we worked a great deal and championed some legislation that passed related to the healthcare workforce, and quite a lot of money to put into training nurses, educating nurses, and not just we don't want to pick on just nurses. It's a lot. It's the respiratory technicians. It's the all the support that physicians assistants that help run the hospital and treat you when you come in to visit us. So that money, that state-funded money, went into the state budget, and so now we are championing initiatives for workforce training.
Wow, I love it.
Yes, and
So
getting them
important.
educated here in Arizona and to stay here in Arizona. So healthcare workforce is a big focus of ours in 23. Also hospital financial stability. And I do want to talk about this because there might be a misnomer that hospitals are just making a lot of money. It's really not true. So what our association did this year was we started doing a current picture financial analysis because we started hearing from our members that they're really having a hard time paying meeting budget. So we have supply chain issues, just as our, grocery store bills went up and everything, inflation across the board, same thing's happening for hospitals. Supplies are exponentially more expensive. We just talked about the workforce, trying to pay to have a stabilized workforce. And when COVID first started, we were flooded with a lot of federal funds. That's dried up. So all these things are a real factor for hospital finances. So the Arizona Hospital and Healthcare Association is really going to look for championing and making sure that we're paid, whether that's through Medicare, Medicaid payments or private health plan payments, all the way to, making sure that we can stabilize our workforce to help that hospital financial stability.
So important. So important. I want to go backwards just a second and talk about
Sure.
workforce. And one of the things that you saw in the hospitals, and we saw it too with home care, is I don't think any of us were expecting as many people retiring.
Yes.
And I think that was something that no one saw coming. And, in my space, and we're talking about direct care workers and home care providers, they're anticipating between 2020 and 2030, that we're going to lose about two-thirds of our workforce to retirement. That's and we don't have enough people coming up. And I love the fact that you've got our legislature behind it.
Yes.
You've got plans and initiatives behind it from an educational standpoint and continuing education, because look, it's a great field to be in.
Yes.
And if you are listening right now and you have empathy and you care, you know what? We need you. And
do.
you know what? It's a rewarding, an incredible experience, and it is fulfilling, and you have purpose. But they also pay very well too,
Right.
which it checks a lot of boxes.
Right.
We need you. And we do. We need you badly.
Yes.
So if you're a parent or a grandparent listening and you have a child or grandchild that's trying to figure out what they do,
Healthcare career is a great
A
thing.
healthcare's career is an amazing. Look, I'm a little bit older. I remember the movie The Graduate with Dustin Hoffman, and the guy said, plastics, healthcare is our future.
Right.
Please get into healthcare.
Right.
Any lasting, we had about a minute, any lasting messages you want to leave our listeners for 23 as we close 22?
Sure, and thanks for that opportunity. And I hope everybody is looking forward to a healthy 2023 start to the new year. But I think based on our whole conversation here today, Bob, it's really for everyone to take care, quite literally. Take care of your health. Make sure you're up to date on where you would go for care, and plan your medical care needs through that advanced care planning. Those would be some of my wishes for folks in 2023.
Those are great wishes. And that last one's so important, and we did spend a lot of time on that. Well, Holly Ward, it's such a pleasure to meet you and spend some time here with you. Make it a great day. Have a great weekend, and have an amazing 2023. We'll be back next Friday. Thank you for listening to Health Futures. It was a great 22. I'm looking forward to 23 being even better.
There's no place like home. You've been listening to Bob Roth's Health Futures. If you have questions about your own or your loved one's future health care, call Cypress Home Care Solutions at 602-264-8009. That's 602-264-8009. Or visit cypresshomecare.com. Be sure to join Health Futures with Bob Roth every Friday at noon, right here on Money Radio 1510 and 105.3 FM.